Hi there, Dr. Rajeev Iyer here. Are you an IMG focusing on applying for residency matching in 2025? If so, I'm going to give you the list of most IMG-friendly specialties and those specialties that are not so much IMG-friendly. This is a two-part series video, and the first part was focused on non-US IMGs, and this video is focused on US IMGs. This is based on my analysis of previous NRMP data, where I have taken the weighted percentages of total number of spots available, total number of filled positions, and total number of unfilled positions. Let's do this together. Thankfully for us as IMGs, NRMP gives such a nice data about both US IMGs and non-US IMGs, which we can make use of to better drive decisions using data. Focusing on the specialties that tend to be most friendly for US IMGs, starting with radiology. I would say radiology, although it's on the list, can be a little tricky. You may want to establish your currency of practice either clinically or with research in radiology, so you do become successful. The next on the list is neurology. The next one is psychiatry. Pediatrics, both primary and categorical, tends to be very IMG friendly. In fact, on the non-US IMG side, it was top of the list. Next is pathology. There are lots of IMG pathologists. In fact, our data says that 1/3 of all IMGs who match into pathology are IMGs. The next one, interestingly, happens to be a combined program of psychiatry and emergency medicine. The next on the list is surgery, but the catch is this is a preliminary year, meaning this is PGY1 only and not categorical. In our opinion, obviously, the best residency is always categorical because you start your residency in one hospital, finish it, you're done. The next on the list is internal medicine categorical. Remember, internal medicine has the most number of residency spots compared to any other specialties, making it highly valuable for IMGs. The next one, interestingly, is emergency medicine. In fact, this is a bit surprising. One of the top of the list is actually OBGYN, but the catch is this is a preliminary year, so you have to be careful about that. And on number 2 is actually family medicine. Obviously, most IMGs do recognize family medicine as one of the most IMG friendly specialties. The surprising thing, the most IMG friendly happens to be combined programs, specifically medicine combined with genetics, pediatric combined with genetics, and psychiatry combined with neurology. This is probably because these IMGs have able to establish some connection with these specialties. If you are a non-US IMG, I personally recommend staying away from combined programs for the most part. There could be exceptions for different reasons. Now let's look at the list of what is not so much IMG friendly for you US IMGs. Well, apart from the combined programs I mentioned earlier, you may want to also stay away from all the other different types of combined programs. The next on the list is actually radiation oncology. Surprisingly, it was on the IMG friendly list for non-US IMGs, probably because of some of the IMGs matching into in that particular year. The catch with radiation oncology is the limited number of spots, which you always have to consider when applying for specializations. The next on the list is orthopedics. Not surprising. The next is ENT. See, all these surgical specialties happen to be not so much IMG friendly. Next one, plastic surgery, then neurosurgery. Interestingly, pediatric neurology is on this list. This is a bit surprising because in general, pediatric neurology happens to be an IMG friendly specialties. This could be due to various reasons, which includes the limited number of US IMGs who have matched in the past as well. The next on the list is physical medicine and rehab. The next one is anesthesiology. Just like non-US IMG, anesthesiology happens to be extremely competitive for IMGs. But if you're an IMG who has already done anesthesiology residency, or you have an established track record of research in anesthesiology, this is certainly something you can consider. The top of the list that is most difficult for US IMGs to match based on this data happens to be dermatology. Making sense so far? If you need our help to navigate all these complexities, you can go to our website www.imgsecrets.com and do book an appointment from there, where we would walk you through each and every step of your application, so ultimately you turn out to be successful with your endeavors. We also have a specific road to residency program where we particularly help IMGs for residencies. Now, here is is a video where I have left talking about the top 5 myths you need to know as an IMG as you navigate through your residency application. I also have a bunch of videos in the description below. I encourage you to check them out. Of course, any questions, do post it in the comments below. We try to get back to you as soon as possible. Take care, stay safe. I will talk to you soon.